Hello, and thank you for joining us today. I'm Thomas Hemmen for TraXel, episode 2 of our podcast. And thank you so much for tuning in. Last time we spoke a little bit about the difficulties that a lot of patients with multiple sclerosis have in finding the right diagnosis. So a little bit more about this today. So researchers have looked at this and find that many patients that present with multiple sclerosis take up to 2 years actually to find the right diagnosis. And why is that? One reason is, and we talked this about the last time a little bit, is that multiple sclerosis does not have a single way of presenting. It can present in many different ways. That's a challenge to both, the patient, caregivers, loved ones, and the healthcare system. So it's very important that when someone displays a new neurological complaint, that you be seen by a neurologist. And how does a neurologist then make the diagnosis? Very important is a detailed history taking. Multiple sclerosis is an often first episodic disease, so getting to know the patient well, getting the history, learning about where they are coming from. Last time we spoke a little bit about that. Multiple sclerosis is more common in people that are born and raised far away from the equator, both in the northern and southern hemisphere. Family history is important. Also considering alternative diagnosis. So the more your doctor or healthcare provider can understand about you, your circumstances, the better. So that takes time, and a detailed history taking is very important. Furthermore, a provider, especially a neurologist that is skillful in examining the body for nervous system dysfunction, talking to the patient, getting to understand the emotional state, the thinking process, memory, focus, concentration, and then the functions of the nerves in the face, the arms, legs, and overall functions such as walking, balance, and such are very important. And a skillful neurologist can often then pinpoint where in the nervous system the problem arises. Now, there are other nervous system disorders that can also present in similar fashions. To distinguish one from multiple sclerosis, often further testing is necessary. There are evoked potentials where electrophysiological tests are used to measure how fast the nerves from the outside connect to the central nervous system. Only a specialist can really analyze those tests, and it's very important that if you are considered to have multiple sclerosis, that you are seen by someone like that. Another important test is an MRI. Many of you are familiar with what an MRI is, and it can be overstated how important MRI scans of the central nervous system, the brain, and sometimes the spinal cord are to the correct diagnosis of multiple sclerosis. And spinal taps. So the fluid that is around the spinal cord is the same fluid that flows around the brain and the rest of the central nervous system. And that fluid often contains really important clues towards multiple sclerosis. Multiple sclerosis is a disease, an autoimmune disorder that attacks the sheaths, the myelin around the central nervous cells. And the breakdown of those myelin sheaths and other markers such as immune tests and inflammatory markers can be seen in the spinal fluid. So it's a lot to take in for one podcast, but just to summarize, multiple sclerosis comes in many shapes and forms and is often a challenge to diagnose. That's why it takes a long time sometimes to come to the right diagnosis. And there are alternatives. There are other diseases that can mimic multiple sclerosis. And seeing an expert, and even considering maybe seeing a second opinion expert to confirm that the right diagnosis is made, is critical. In future episodes, we're going to talk about why this is so important. Obviously, it's very important to know what your body is undergoing, to better understand what's going in on you. But it's also important because it leads to treatments. There are many very effective treatments for multiple sclerosis. Finding the right treatment, knowing whether or not the treatment was working on you, those things are very important. And we at TraXel are aiming to provide tools to enable you to both track the progress of your disease in the future and also to give feedback on whether or not the treatment is working and what alternatives to consider. So hopefully you enjoyed this podcast, and we'll talk to you soon. Thank you so much.